Hi, Delicia or Delicia. I I'm hoping I'm not butchering your name. If I do, I apologize. I loved watching your video. I was so shocked to learn that you've never been in counseling. Most people who come into the health profession is because they've needed help themselves. And I guess it's their way of giving back. They wanting to help. So, I thought it was pretty cool that you've never been in counseling. I did have the same assumptions as you when I first went to counseling, like, tell me what to do. Kind of bummed when I found out it was more of empowerment, but over time, obviously, it makes sense. Um, I did was I did when you asked your question about challenging without pushing too hard or possibly threatening the therapeutic relationship. I thought that was such a good question. When I looked in the text, Simmons, Lily, and Quinley, Quinley, is it Quinley or Hunley? Quinley. When I looked in the text, I noticed that it was cited as an advanced skill. So it's something that we would learn over time and learn to perfect. And I think with that learning and application, we would understand, when to do it, how far to push, and also like when to stop. And I don't really see challenging as so much pushing. I think it's what follows the challenging. Like, you just said this, but I remember in another session that you said this. You want to tell me more about that? Challenging I see is more of highlighting discrepancies and incongruencies. I think the push comes when we suggest or empower the client to, take some sort of action to realign what they've said previously against what they're saying now. And I think that's when it comes to pushing too hard. I noticed that the second counselor, the client was afraid of inviting people to go out with her and do what she wanted to do because she was afraid of being rejected. And the counselor said, "Well, in the next 7 days, I want you to invite people two times, two separate times, to go out with you and do what you want to do." And I thought two was a bit aggressive. You could tell the client was really uncomfortable with it, and I get that we're supposed to help them get out of their comfort zones to achieve their goals, but I think it should be more of a flow, not a rush. So I probably would have done one, but again, we don't know what the therapeutic relationship is like. We don't know what her goals are exactly. So I think it's something we learn, and then we become more attuned with the circumstances and we decide. So I know it's a concern now, but I don't think it'll be a concern for long. Thank you for a great post.